Well, my name is Dr. Richard Brooks. I think I know most of you in the audience, but perhaps some of you don't know me. Anyway, I'm a retired internist, and I'm a member of our Community Affairs Committee, and we have a subcommittee that one of the chief functions of that subcommittee is to arrange for programs for our membership and for the general community at large on various topics. We've been pretty much centered on healthcare issues and lifestyle issues and promoting wellness and health. And today we're staying with healthcare. In the month we're going to have a presentation on fitness and exercise. And the following month in November we're going to have one on shared decision making and how to get the best out of your relationship with your provider. So that should be of interest as well. And we're really open to suggestions for various subjects. And it doesn't have to be always healthcare and wellness and so forth, but we're thinking about having maybe the Green Mountain Power Company come and discuss programs that they're promoting in environmental enrichment, just for point of interest. So if you have any suggestions, write them down, let us know, or call us anytime, and we'll consider having a discussion on those subjects. Today's subject is about Medicare. It's entitled A Medicare Discussion, Navigating Annual Enrollment. How many of you have received something in the mail already about the changes, about this time of year we get information on how to make changes in your Medicare program? I know I did. They're coming, and they're always a kind of a thick book, and I look at it and say, am I going to read this? Start reading a few pages, and I don't get enriched necessarily. And one thing about it, being a doctor, doctors don't know a heck of a lot about insurance or Medicare. They just know some general topics, and so if you ask your doctor about, well, how much does this cost, and how much is insurance going to cover, you're not going to probably get very good information for the most part. So anyway, Medicare has been with us quite a while now. It started in 1956. It was called Medicare, but that term Medicare was for families of active military duty people and coverage of their families. That was the first Medicare. Then in 1965, Lyndon Johnson signed legislation to start Medicare for people over the age of 65.
Dick, I don't think the mic is working.
It's working.
Is it?
No, I don't think
Hold
so.
it facing you.
Either you're not close enough to it or something.
Or maybe it's not turned on.
Turn it on.
Okay,
Well,
hold it out this way.
Like that.
Now can you hear me?
There you go.
Okay.
That's what you need.
All right. Now you can hear me. Anyway, so Lyndon Johnson signed the bill, and he went to Independence, Missouri, at the Truman Library in Independence, Missouri, and Harry and Betsy Truman were the first Medicare recipients. Just a point of interest. And I was just getting out of medical school about that time. Boy, did I hear it from the doctors. Medicare, government interfering with our health care. We don't want that. Well, about 5 years later, they couldn't be happier. Probably even before that, because they had a lot more patients than they've ever had before that time. And they were getting paid a reasonable rate at that time. So that's kind of a background of the history. But today we're going to have a discussion about Medicare and what's involved in all the different programs. And we'll have a question and answer.
Hold it up.
Q&A. Q&A at some point, about 45 minutes to an hour, and hope that you have some questions and maybe some comments to make. We are very privileged to have Patricia Coogan today.
The mic's off again.
I know it is. Oh, now it's back on.
Yeah.
I don't know what happens to it. It's back on. Okay. Thank you. Patricia Coogan is a resident of Pomfret, Vermont, and she is a volunteer for the Senior Solutions aspect of Vermont, which helps senior citizens throughout the state in making various decisions. Sorry about that.
Yeah.
So, I hope your microphone responds better. It's turning off. Maybe it's more. But Patricia has been working recently, volunteering to help Medicare recipients make choices in the Medicare program. A lot with the Program D, which is the drug program. She's going to be discussing that as well. She's also a doctor of science, as you can see from her name up there, and she's a professor at Boston University in the epidemiology and public health department, where she does research on drug use, chronic drug use, and its complications. Now we got a better mic. Better hide this one. Okay? Yeah, that's better. I think the battery's down on that or something. So, without further ado, I'll introduce Patricia, and she's going to take over.
Thank you very much. This is a nice turnout. I think this shows how confusing all this whole business can be. Even if you've been on Medicare for a while, every year, right? This thing, something like this, comes in the mail from your drug plan, and you think, oh no, do I have to read this? And the answer is you have to read part of it. But first, before we get into it, I want to talk about the SHIP program in Vermont. We're part of the Area Council on Aging. We provide for free counseling on any issue related to Medicare. And it can help you sign up for Part D or any Medicare plan. And then further down the line, if you have issues with billing or you want to make an appeal, you call the SHIP counselors, and they're trained people. They're not volunteers. This is what they do for a living. And this is what they do. So I gave out flyers, and you just call the 800 number that's on that, and you automatically will go to the SHIP in our Windsor County, which is the Windsor County one, which is in Springfield, and it's called Senior Solutions. Yes?
You have to be a Vermont resident to use this service?
You probably, I don't know. You probably would, in order for them to be able to access sort of the information about you, but I think it would depend on what your issue was. So what am I going to talk about today? The focus is going to be on Part D and drug plans, because that annual enrollment period is coming up very soon in October, where you may consider making a change. So first I want to go over how drugs are covered under Medicare. You don't get them all under Part D. And why you need to assess your drug plan each year. And like I said, this book that you get, it's a legal document, and it's called the Annual Notice of Change and Evidence of Coverage. And the Annual Notice of Change tells you, in not many pages, in this one, which is for the this is Humana Walmart plan, it's only 11 pages. It's very clearly put forth, I think. The rest of it is literally the legal obligations of what they are providing you. That's the evidence of coverage. It's like the contract that they have with you. And it's also a list of the drugs that they cover. I just also wanted to point out that every year, since you become eligible for Medicare, you should be getting one of these books every year. These are actually also very helpful and has a lot in Part D. And as you know, Medicare is a federal program. This book is the same for every state in the United States, except the very last few pages, which list what Part D drug plans are available in Vermont, and also what Medicare Advantage Part C plans. So that's, you can always look in the back of this book to see what plans are available. All right, let's talk about how you get Medicare and prescription drug coverage. First, I want to ask, is anyone not on Medicare yet? Oh, my goodness, so all right. I also give a new to Medicare presentation, which is more general. This, I was under the impression most people would already be on it, but let me just give a little overview of how you get prescription drug coverage. There's two ways to get Medicare. There's what's called the original or traditional Medicare model, where you get Medicare Part A, which is hospital insurance, and Medicare Part B, which is insurance for office visits and so forth, care you get not in a hospital. You get those directly from Social Security. You deal with Social Security in Medicaregov. Then, because, as you know, Medicare A and B doesn't cover all costs, there still can be substantial costs after A and B have paid, you can then purchase supplement insurance, which is called Medigap, to pay that 20% of Part B that isn't covered, for example. And then to get drug coverage, you buy a Part D plan from yet another private company. So here you're going to have 3 cards. One is your Medicare card from Social Security that shows that you're covered with A and B. Then you have another card for your Medigap supplement plan. And then when you go to the pharmacy, you have a third card, which is your Part D plan. So I want to know, those of you who have Medicare, how many go this route with getting all the, okay. There's a second way to get Medicare A and B, and that is called the Medicare Advantage plan. It's also called Part C plans. And in that model, you don't ever deal with Social Security. You're dealing entirely with this private company for your A and B coverage. They also provide, they cover some out-of-pocket costs, so they kind of function as supplement insurance. And most of them also cover drugs. So you have one card. Does anyone here have that model? Oh, okay. Oh, that's more than I thought. Well, I would like to say that this presentation is really geared at the Part D drug plans, but for those of you on a C plan, everything I say about how drugs are covered goes for the Medicare Advantage plans also. If you know, there's only 3 of those Medicare Advantage plans available to us in Windsor County. So I don't know if anyone is considering changing, but if you are, if you're happy with your plan, and the doctor you like is going to stay in their network, and the drugs you take are going to stay on their formulary, I would say stick with them, because there's only 3. You know, if you go to other states, there's a long list. The Part D drug plan, it's easier to switch. You're just switching that, and that's what you can switch every year. So what covers what? Again, Part A is hospital insurance. That's what Medicare pays when you are admitted to the hospital, not under observation. You always have to make sure when you go in there, have you been admitted? That is a critical question. By law now, they have to inform you before 36 hours have passed if you're still under observation, because Part A won't pay for it. Now, when you are admitted to the hospital, Part A pays for all the medicine you receive while you're in the hospital. Every aspirin, everything is covered by Part A. Part B is medical insurance. That's what covers your visits to the doctor, to outpatient clinics, all the lab tests you get outside the hospital. That's covered by Part B, which, as you know, pays 80%, leaving you with 20%. There's also can be co-pays and co-pays. And that pays for certain drugs. Basically, Part B pays for drugs you can't give yourself, that you have to go into a clinic because they're infusions or shots, like chemotherapy, certain vaccines, although not all vaccines I know. So those things are covered by Part B. Everything else is covered by Part D. All other prescription drugs, to be covered, you need a Part D plan or you need to have a C plan that includes drug coverage. And again, it's prescription drugs only, no over-the-counter. If anyone has any questions, just ask as we go along. Now, last week, I spent 2 days in a Medicare training session, and my head is still spinning from that, really, for real. And when I walked away from that with a really major message, which is for all of Medicare, there are enormous nuances that no one, including your doctor, including you, including a ship person, could possibly anticipate all the different situations. So, and there are also nuances of coverage with Part D. And I'm just giving you some examples. For example, if you're in the emergency room and you get and they give you something for pain by mouth, that's not covered by Part A or Part B. You're just going to get billed for that. That's a nuance. Who knew? Part D covers insulin and any supplies to inject it, the syringe, that's all covered by Part D, but the test strips are covered by Part B. And there's a question about the needles on the syringes. Someone said to me, but I think they're covered by Part D. And for example, Part B covers those vaccines listed there, flu, pneumonia, and hepatitis B, but it doesn't cover shingles vaccine or a tetanus booster. If you cut yourself open and they have to give you tetanus then it's covered. And I'm not telling you all this for you to even remember it, but just to inform you that there's a lot of nuances. So if you get a bill and things just look crazy, don't freak out. Just call first. There's probably some obscure regulation that dictates how it has to be billed, which you need to find out. All right, when to sign up for it. And I'll say this for the people who are not on Medicare yet. You have an initial enrollment period to sign up for A and B, and a supplement plan and drug coverage. And that is a 7-month period that includes the 3 months before you turn 65, the month you turn 65, and the 3 months after. That's your initial enrollment period. And if you're working and you have health insurance that you like through your workplace, you don't have to sign up when you turn 65. You can wait, and then there's another period. If you don't have credible coverage when you're 65, you need to sign up in the enrollment period, or you get a penalty, a financial penalty, in terms of your Part B premiums being higher forever. It never goes away. So anyone here who is facing turning age 65, just get right on this and get it all at once. Get A and B and sign up for supplement and sign up for a drug plan all at once, so it starts that first day of the month you turn 65. Okay, okay, we're not going to go into that. Now, the good news about Part D plans, drug plans, is you can switch them every year very easily. Not true with the Medicaid supplement plans. It's not so easy to switch those. Part C plans also you can switch every year. So that's really what I'm going to focus on. Why do you need to think about this every year? And I just also wanted to note that if you move, these Part D plans and Part C plans are really place specific. So if you move to Florida, which none of us are going to do now, then whenever you move, you can drop your old plan and get a new plan. But let's assume we're all going to stay here. So why would you need to think about this every year? Why do you need to assess your Part D plan? And if you have Part C, just take a look at their formularies. Because the drugs you take may change. Either you may get better and stop taking a drug that you're paying a lot for, or you get diagnosed with something and start taking a drug that could be expensive. Anything could happen. That's why it's insurance. So that's a good reason always to check every year. Yes?
Is this appropriate for me to ask a question?
Yes.
Okay. So when I turned 65, I'm not taking any drugs at all. So did I sign up for D? I didn't realize there'd be a penalty. What kind of penalty is there? For D, if you haven't signed up, I am now 75.
So have you signed up yet?
No, now I'm thinking, oh my God, if I
You're going to have a penalty,
I'm going to need these drugs, and I'm going to have to sign up. So there'll be a penalty.
There's going to be a penalty forever, unless they change the law, in terms of the premiums that you will be paying for your Part D plan. And it is a complex formula which,
So you don't need to do that now, so it will be
Yeah.
a penalty.
you will have a penalty.
And I can call your number and someone
Yes.
can help me do that.
Yes, yes,
Okay.
yes, yes.
Is the exception to that if you have insurance, for instance, Cigna, and you would want to be signing up for D or any of these other things except for D, and you have within 63 days, I think you're signing, in which to sign up, in which case you wouldn't be penalized, you would have a sign-up period.
Correct. In other words, if you're covered through your workplace, is this a scenario you're talking about?
Correct.
Yes, and it's credible insurance, which I'm sure, ask if it is, then yes, then no, you don't have to sign up for anything until you're ready.
Well,
And-
you do have to sign up for A, excuse me. Hospitalization.
In some workplaces you don't. Mine you don't, they pay for everything. BU pays for everything until you leave them. So, but it never hurts. I always say sign up for A at 65, it never hurts. They just won't ever bill Medicare if you're on an employer plan that is covering you. And so let's go back to this 63 days, just basically if you have a Part D plan, never go 63 days without coverage. That's a little confusing, but just basically always have continuous coverage because the goal of this policy is to keep people continually covered. All right. So the drugs you take, the plans can change formularies, and the definition of a formulary is the list of drugs that a plan covers. That's the formulary. And they can change that every year. And drug you're taking they may decide not to carry it anymore, so you need to check. Plans can change their cost-sharing schemes, and by that I mean how, each plan has come up with a business model of how much they're going to pay for a drug, how much you're going to pay in terms of co-pays or co-insurance. That's what I mean by cost-sharing schemes, how you and your plan are dividing up the cost of that drug. They can change that every year. So a drug you're taking that maybe was kind of inexpensive, they may decide to change the way it's covered and it may become more expensive or less.
Can they change that during the year?
No, they cannot change that they cannot change the formulary during the year except, again, a nuance, under certain conditions. If, for example, a drug is taken off the market, obviously, then they're going to take the formulary. They cannot change the cost-sharing scheme. Except at the new year. This is what you're looking for, to see it during this annual enrollment period. This is what they can change every year. But they can't surprise you during the year. And they can change the pharmacies included in their network because every plan has enrolled pharmacies that it will use. Now, I want to say plans can change the cost of their drugs at any time during the year. Now, you must understand that each of these Part D plans is negotiating what they're paying with the pharmaceutical companies, and they're all negotiating different prices. And as you've read in the paper over and time and again in the past few years, pharmaceutical companies can change the price of a drug anytime they want, on some famous cases on the web. Everybody's favorite, Martin Shkreli, who's just not allowed to be out of bail anymore. He's famous for increasing the cost of a drug, I think it was 4,000%. And when that happens, then consider this. If you're taking a drug that costs $100 a month and your co-insurance is 20%, you're paying $20 a month. If the pharmaceutical company bumps that cost up 10 times, then your percentage is going to go up 10 times. So if you see that that's why costs you're paying can change during the year. These top three things, though, the changing of the formulary, changing the cost-sharing scheme, and the pharmacies, that can only change, starting January 1st. Okay. All right, Part D plan basics. And this is also true for Part C, these things about drugs. They're run by private companies, but they are regulated by Medicare. Medicare sets the range of the premiums, which in Vermont, the cheapest plan is something like $14 a month, and it can go up to almost $200 a month. That's just for the premium. And that doesn't really pay for any drugs. That's kind of your membership fee. You pay that every month. They also set the maximum deductible, which just like with auto insurance or anything, many Part D plans have a deductible, which is what you must pay before the company starts covering anything. So Medicare sets what that maximum can be. It specifies drugs that must be covered, we'll talk about that in a minute, and drugs that cannot be covered. So that's all. And as we just noted, each plan negotiates its own prices with the pharma companies. Despite these regulations, the plans vary greatly. They vary greatly in terms of what drugs they cover, what their cost-sharing schemes are, and what their premiums are. And so this is why you need to shop around every year, because you really could save money. So formulary, again, a list of the drugs covered by the plan. Now this is what Medicare says. You have to cover at least 2 choices in any one drug class. So for example, if you take ACE inhibitors for hypertension, there's a long list, maybe not a long list, but there's a list of ACE inhibitors. Each plan has to cover 2 so that you have a choice. They can cover more if they want, but they have to cover 2. Okay, and for certain conditions, mostly all available drugs, they have to be covered. Like, FDA approved chemotherapy, it's going to be covered. They have to cover, same true with anticonvulsants. Antidepressants, in fact, Part D plans have to cover all of them. And certain drugs cannot be covered, and these, for example, are barbiturates or benzodiazepines. These are drugs that are not recommended that people over 65 take because the side effects are greater, and they increase fall risks. And basically, you shouldn't take them. So they won't be covered. Your doctor can prescribe them, but they won't be covered by Part D. So, nevertheless, despite the regulations, formularies vary greatly among plans, and plans can change their formularies at the new year. And that's just about the main thing you're going to be checking for every year. Is what I'm taking still covered? All right, cost sharing. Again, this is how the plan divides up what you pay for the drug and what they pay. I mentioned there's an annual deductible in 2018. It can be no greater than $405 a year. Some plans don't charge any deductible, and they can charge less, many do. And then there are co-pays or co-insurance. And so co-pay is when you pay a fixed absolute amount. This is usually for cheaper generic drugs where, it's $1 when you fill them on supply, or $4, flat fee. Then you get in, for the more expensive drugs, they get into the co-insurance, which is you pay a percentage of the drugs, as I just described in that example of if a drug price increases, why you would have to pay more mid-year. And then there are tiers, which is all the drugs. Each plan categorizes the drugs they offer into tiers. They usually have 5 to 7 tiers. And the first one, tier 1, is the cheapest, by which I mean most inexpensive generic drugs, going up to extremely expensive specialty drugs, like that you would see advertised on TV all the time. So I just, and I'm sort of going through this just so when you get the monthly report you get, if you fill a prescription, or when you're reading this book, it sort of makes sense of what you're reading. So I just wanted to give you an example of the Humana Walmart tiers for 2017. So you can see tier 1, you just pay $1 for a month's supply of a typical generic. More expensive, this would be more expensive generics, you pay $4. Then in the upper tiers, you're paying these percentages. So that's how that works. And I have not gotten the 2018 book yet for this, but these tiers and cost sharing did not change between 2016 and 2017. So they may not change, but they may change. So, and the cost sharing schemes vary greatly how plans do it. It's just all different. And they can change that scheme every year. Other things that could change. For some drugs, I'm sure you've all seen this, you need to get prior authorization, which means some poor nurse in your doctor's office has to spend all this time on the phone documenting that the drug is medically necessary. I always feel the prescription should indicate that the drug is necessary, but I guess that's not enough. These are obviously drugs they don't want to pay for, right? Quantity limits. Many drugs have quantity limits. Things like, for example, sleeping pills may be limited in how many you can get. In fact, I think I have a memory from that conference I went to where if you're on a Part D plan, you can only get 90 a year. Forget that, that might not be true. But there are quantity limits on many drugs, so you want to make sure it's covering the number you want. And then some drugs you're required to go through step therapy. This is if your doctor chooses a drug, kind of an expensive, up there, new drug, say, and the plan doesn't want to pay for it and says, there's other drugs that are less expensive that will treat that same condition. You have to try that first. So those are the things you're going to be looking for. Oh, you know what? This has gone really fast. So really, that's what you need to think about when you're assessing your plan every year. If you're new to Medicare and you do not take any drugs, don't say, well, I don't take drugs, I'm not going to buy a D plan, because, as noted, you get a penalty. The penalty is forever. There is a really good website, Medicaregov, that I wanted to show you, because this is a very easy way to assess whether your drug plan whether you need to switch your drug plan, whether you'd save money or you have to switch to get the drug coverage that you need. You can do it yourself. If it looks like a little bit much, you can call Senior Solutions, that SHIP Healthline. And I want to show you this because this is exactly what the person is going to be doing at the other end of the phone. So, let's see if we can do that. Oops. So the site is Medicare.gov. So I've been there so many times that it comes up automatically. I think this is a really good website. You can get any question answered on Medicare.gov. Sometimes you have to search around for it a little bit, but they have a search field. So what I want to show you is how you would go about saying, do I need a new Part D plan this year, or a new Part C plan? And you go to Find Health and Drug Plans. And health plan refers to the Medicare Advantage Part C plans. So you click on that. And there's two ways to search. You could just do kind of a general search in your area, or you can put in all the information about you. So if you are already on Medicare, put this stuff in there and they'll know everything about you in terms of if you get extra help paying and so forth. But we're just going to go on and say 05001, which is my zip code, which is White River. And then you just do Find Plans. And then it starts asking for information. So it says, how do you get your Medicare coverage? And let's say this person has original Medicare, and they want to know if you get any extra help. And let's just say I don't get any extra help. Or you can say I don't know. And what you're going to do here is list every drug that you're currently taking. Just have them all in front of you. If you're going to call Senior Solutions to do this, have all your drugs, pills in front of you so that you can tell them. So you just type it in. Let's say someone takes lisinopril for hypertension, and then it wants all the specific information. So it usually defaults to, I think, the most commonly, or very commonly used doses. So this is 10 milligrams, 30 a month, and I'm going to say we're using a retail pharmacy. And then we add that to the list. And then if you go down a little, you can see it's been added. It's starting a list for you. Let's put in something else. Let's put in Simvastatin, since so many people take that. Let's put in Simvastatin, which is to lower cholesterol. And we're going to say yes. You know, you would tailor this to what you get, and we're going to add it. And then let's start with these simple drugs right here. So this is all this person takes. So you say, my drug list is complete. And then they say, well, tell us what pharmacy you want to use. And you can select 2 pharmacies. Now, this looks like there's only 2 available, but there's not. That's 2 available within 1 mile. So you drop this down, and the next is, inexplicably, the next choice is 19 miles. So you choose that, and let's say, well, you can choose up to 2. So let's say, all right, I go to Rite Aid, and maybe sometimes this means there's a second page in honor of Jim Marmar. I go to Woodstock Pharmacy, which I actually do. So we're going to add that. So we've added our pharmacies. And we're going to, I'm sorry this isn't showing the whole thing, continue to plan results. And here, it's going to ask you, well, what kind of plans are you looking for? And I'm going to say we're looking for prescription drug plans, which is Part D. If you're going to check your Part C plan, you would click Medicare Health Plans with drug coverage. So you click that, and it's telling us already there's 21 plans available for us here in this area. And then you go to continue to plan results. And it brings up a list of all these plans. I want to show you, again, inexplicably, it always puts up this original Medicare. I don't know why they do this, just skip that. Because original Medicare A and B isn't paying anything for your drugs, for the drugs. You go right down to the prescription drug plans, and here they're listed. You can list them in several ways. Now, I wanted to make a point about this website. If it seems confusing to you, I just want you to see what's available on the website. It's really very powerful. Starting in October, when the annual enrollment period begins, they're going to change this so that you are going to be checking the costs for 2018. And there's going to be a little button up here that says for 2018. But that's not up there yet because the enrollment period hasn't started. So right now what it's showing us is how much is it going to cost, allowing you to compare plans for the rest of this year. It's sort of, it's aimed at someone who says, I have to change my plan right now. But you're going to be looking at what it's going to be like for 2018. And let's say you're really interested in premiums. You can sort by lowest monthly premium. And you do that, and then you have to tell it to sort. So, here are the plans. Envision is the cheapest plan available in Vermont in terms of the monthly premium. And it then says all your drugs are on the formulary. There's an annual deductible of $260. There's a copay that's going to range from $1 to $15, and the coinsurance ranges from 10 to 27%. And it gives that same information for everything. The next cheapest in Vermont is the Humana Walmart at $17 a month. So you see how if you don't use any drugs, you buy the cheapest plan. It's insurance for you, so that you won't get the penalty. Then when you need drugs, you can switch to a different plan if you want, with no penalty. Now, so you're going to look and make sure all the drugs are on your formulary, and you might say, there's drug restrictions. What does that mean? So let's look at that and see. That brings up all the details about the 2 drugs that we have entered, saying you're getting generic, and there's quantity limits on the Simvastatin. And the quantity limits is 30 tablets every month, which is pretty standard. Now, you're probably thinking, and then to go back, you close the window. You don't use the back arrow key. I learned it very hard way. Okay. So, but you say, well, it's really hard to compare, in this format. You can compare 3 at a time. By clicking them, say I want to compare the 3 top ones with the cheapest premium. You say those three, and then you say compare. And then it brings them up side by side, which is very nifty, and something about the way I'm hooked up to the screen means you can't see it all at once. But so you can see you can look at the monthly drug premium. You can look at the deductible. You say, well, look at this one. It's got the cheapest premium and it's only $260 deductible. That's Envision. And then they give more specific estimates of what you're going to pay. And again, since this is aimed at someone who thinks, I got to change my plan now, it's saying, if you enroll today, this is the cost. And here it's showing what you will pay totally at the different pharmacies. And look at this variation. I wish Jim was here. He could answer that question. Medicare Walgreens, I guess you want you not to go to a independent pharmacy. I do not know. I have a little trepidation getting too much into these numbers because it's pretty, it can be confusing, and also, like I said, this isn't showing what you're going to see when you do it in the annual enrollment period. But you will be able to compare basically what I have been trained to use. It's going to give you, for 2018, this is going to be your total drug cost, and it'll include the co-pays and the co-insurance and the premiums, and just for the year. And then you compare that, and we just advise people to take the one that's going to cost you less. May not be the cheapest premium, but due to the other cost-sharing aspects, it could be the cheapest plan to use. It also always gives a dollar amount for if you use mail order. Often that's cheaper, but not always, to my surprise. There's some plans where it's actually more expensive to go the mail order, 90 days at a time route. So that, yes, you can. So if you do this yourself and you feel confident what you want, right here there's a button, enroll, and you just click that. Well, let's just see what happens. You will be automatically disenrolled from the plan you're currently on. You don't have to tell them. And you're enrolling you're enrolling via Medicaregov, and it says you're enrolling in a 2017 plan, and then it just asks you questions and asks you for your name. I don't really want to go any further than this. It asks you why, and let's say if you moved, you say, well, I just moved, and so forth, and then you put in your information, and you're enrolled, and they'll send you documentation, and they'll send you this. If you move or change at any other time during the year, you do have to tell them you're disenrolling. This is the only time you don't have to. Just another little confusing thing. You do have to tell them.
Question?
Yes.
If you're on an Advantage plan,
Mm-hmm.
which covers prescriptions,
Yes.
and at some point, 5 years from now, you decide I really need Plan D, I need more coverage for prescriptions, are you still penalized? And did you have it with C anyhow?
If you had a C that had drug coverage,
Right.
during this open enrollment period, you can switch to a Part C plan that doesn't have drug coverage. And I think there is one in Windsor County. And then you could buy a D plan. And no, you're not penalized because you had credible coverage. Like I said, all the regulations I said Medicare puts on Part D plans, they put the same regulations on the drug part of the Part C plans. So it's the same. Yes?
So if you have a full retirement with an insurance plan that comes from the company, and you don't, and drugs are covered by that plan, but then your company decides to renegotiate the health care plan or whatever they're providing to retirees or current employees, then you all of a sudden don't have drug coverage, because you had through your employer with
another plan that you have Blue Cross and covers prescriptions, so you don't have to get the Part D. But
In a retiree plan, that's
Right.
true, yes.
But then if something changes,
Mhm. You do not get a penalty, then you can change, yes. It is reasonable. Obviously, if something like that happens, you're not going to be penalized for it. Yeah, now, the one thing I want to caution about is COBRA. I'm on COBRA right now because if you fall below a certain percent time working, you lose your health plan, which happened to me. So I'm on COBRA. And I timed it exactly so that when my 18 months of COBRA is up, I turn 65 that month. So it would be like a seamless transition. But my point is, COBRA is not considered credible coverage. So if you're over age 65, 66, and you say, oh, I really like my employer plan, I'm going to stick on COBRA, I'm going to stick with it on COBRA for 18 months. Don't do that. It's not considered credible coverage. And that may be the case, with the drug coverage too. So I just want anyone who isn't on Medicare yet to keep that in mind. Who knows why they determined COBRA not to be medical coverage, other than they want to get people off the private plan and onto Medicare. That must be the reason, I suppose. Same with retiree, like if you're on a whole retiree health plan, the whole thing is not considered credible coverage. So except for the drugs, if you have retiree health, this is one of these nuances. If you're going to retire and stick with a retiree health plan, you sit down with your HR person and get the actual situation of what you should do, should you sign up for Medicare. Yeah. Yes.
I'm 4 months older than my husband,
Mhm.
so when I retire and starting into the Medicare, how does that work? Because I'm going to sign up for it now,
Mm-hmm.
and I have Blue Cross Blue Shield,
Through your employer?
Hartford,
Okay.
and he's under my plan. So when I start filling out all the paperwork and whatnot, what do I do with them? Do I have to?
Yes. I would say if you're 4 months older, so 4 months after you turn 65, I think you'll need to be on COBRA for 4 months, which is allowable. You will not be penalized because you have 8 months of losing the coverage to where you have 8 months. So
Oh, okay.
if you were, 3 years younger, then you would really have to go on the marketplace, go on the marketplace and get yourself an individual plan. But you're not going to have to do that. Yes, yes. So you'll be paying for COBRA for 4 months. But again, sit down with your HR person anyway and say, this is what's happening. Yes.
if the drug plan says Humana Walmart,
Mm-hmm.
does that mean you have to get your prescriptions at Walmart?
No. No. They have a Humana. I got Humana Walmart for my brother. It's got a huge, and we've been happy with it. Of course, he
Well, I
doesn't.
have my parents, and that's always
Oh.
been in the back of my mind, because they have a drugstore, they like to use it,
Yeah.
they're not changing it. And so, but in my mind, I'm thinking, well, sometimes it's cheaper, but I don't know, I never could find out if it was true.
Oh, now you can.
Someplace else.
And also, you'll need to check and see, are they still including that pharmacy in the network?
Right,
They may decide not to. Who knows?
And it's been my experience with my mom, she has the Envision plan
Oh,
up
uh-huh.
there. And even though there was a deductible, because I chose to get all of her drugs through the mail order,
Uh-huh.
the deductible was, nobody cared. I mean, she didn't have to pay that deductible, she just had to pay. The first time I ordered prescriptions for her, 2 of them were free,
Yeah.
and the other 2 were like $3 a piece.
Yeah.
I just ordered some more for her, and each one was $2.
Well, now this is true. I've run into this with my husband, who just takes the generic hypertension, cholesterol pills, and on Envision.
Yeah.
The same thing. I think if they're really cheap, it's just like, you're just going to pay the 1%, $1 or $2 or whatever. If you get a more expensive drug, then you're going to probably be paying that.
Each time you see the doctor, like my dad would see a doctor
quite often,
Mhm.
every time things change. So it doesn't make sense for us to try to get drugs in the mail order for him, because then you have all these drugs and, next time you go to the doctors, they say, oh, we don't have to take this anymore, we're going to change this or increase that, and so we did his just through the local drugstore.
Right, and they just passed some new rule to try and avoid that situation. But it's somehow to address that, so that if you do that, you don't get charged for the pills that you're not using. They've just done something. Yes?
What's the relationship, if any, between Obamacare and Medicare?
There is no relationship with certain exceptions, and the exceptions are Obamacare funded certain pilot projects they have been trying to do in Medicare to devise ways to deliver quality care more cheaply, and Obamacare provided some funding for those projects. The second thing is, I'm sure you've all heard of the donut hole, the coverage gap, which I decided I wasn't even going to go into unless somebody asked. But when you get in the donut hole, it was part of Obamacare to close that gap, so that every year you're going to pay a smaller and smaller amount of the drugs charged to you while you're in that donut hole up to 2020. Now that was part of Obamacare. So, the other thing, a really important thing, is this isn't drugs, but as you know, Medicaid pays for long-term nursing care. Medicare does not pay for long-term custodial care. It'll pay for 100 days of rehab after you've been in the hospital, say with a hip operation. But if you're in long-term, you burn through all your resources, then you need to go on Medicaid, and that's what pays for long-term custodial care. And there's a huge proportion of people in nursing homes are on Medicaid. And that would be threatened. So during this sort of repeal effort, which may be raising its head again, I understand, as the nursing homes are going nuts, because, cutting back Medicaid that much, that's how it would have any changes there would have a huge effect on the aged population. Yes?
What does Medicare Part A cover as far as hospitalization? Is there a limited number of days that they will cover for you in the hospital?
Yes, but it's very generous. Unless you have an absolutely catastrophic accident, burn, illness, it covers. You got to remember this without my overhead. It covers the first 60 days. There's a deductible of about $1,300. If you're in there one day, if you're in there 60 days, that's it. After day 60 through 90, there's a daily copay of it's like $350 or something. We won't even discuss what happens after 90 days. It doesn't happen that often.
Yeah, but it's my understanding with our Advantage plan that there aren't limitations with the number of days in the hospital that there is for Medicare.
I don't know. Do you know the answer to that? I do not know. I'll have to check that out.
That was one of the reasons we decided to take the Advantage plan. It's a
Uh-huh.
lot cheaper.
The Advantage plan is cheaper, but what about the restrictions due to network?
Yes.
Right.
Is there a way to go online and find out what providers are on?
Yes, I would call them. They say, they have websites, but everything I've said they don't really keep them up to date because networks change. The hospitals in the network and the doctors, and they change. So call them and say, is my Dr. X going to be in the network next year?
When will all this be available for 2018? October?
Well, the annual enrollment period starts enrollment 15, so it'll certainly be up October 15th. I don't know how many days before that they get it up there. Yes?
Can you switch between a Medicare Part C and a traditional Medicare plan at any point?
You can. That turns out to be, you mean you've been in a Medicare Part C plan for a while and you don't want to...
In this case, it applies to my husband. He has Medicare Part A because when we went through enrollment, the person who helped us felt that was the best place for us to be. I forget what the disadvantage is to C.
So you're on Part C. Your husband's on Part
we're
C.
in A.
A and B?
A and B, and a
And-
supplement.
and a supplement.
And D.
Oh, and D, and you're thinking you want
And
to
I
switch?
just wondered, what's the advantage to C and what's the disadvantage to C? I can't remember what the disadvantage is.
The disadvantage is, as just brought up, they are networks. The Part C plans have networks of doctors, and if you go out of network, either they don't cover anything or they cover it at a much lower rate. Doctors and hospitals, and the networks change, and the networks are becoming narrower over time. The other big disadvantage is if you move, or if you decide to live in Colorado for 3 months of the year, you know, your health care won't be covered up there.
Oh, that's not right. If it is the network, because we go to Arizona for the
Okay.
winter, and fortunately our network here, because it's a PPO network
Okay,
at DHMC, they have a similar coverage network there.
okay.
And then you get what's called a passport.
Oh,
You have to
excellent.
call and get a passport. But you're right as far as there are limitations and those networks, I think, are shrinking.
Yes, thank you for that. You know, there's several different kinds of Part C. There's the PPO and the PFS is something, and I'm not an expert on this, so that's very good to know.
So it works while we live here and, you know, are in a certain area of Arizona. But if you move, then it's not going to
Right, if you move.
necessarily
Right,
cover.
right.
And you may be restricted on seeing a specialist with a referral. You're not,
We don't even have to have pre-approval.
you can go see
And what plan is that?
the
United Health,
Okay, that's
Advantage.
good. So you're happy with that plan?
right now we are.
So, but not all plans operate that way.
Yeah.
In many
Yeah.
plans, many of them are HMOs, and then you do need a referral from your primary care physician to see anyone.
And they make it harder to get certain tests performed on networks.
Well,
Like getting approval from,
Getting approval.
like MRIs and.
Well, they have to, the Part C plans have to cover what Medicare covers. But you have to get approval from them first, which you don't have to do. If you just have Medicare A and B and a Medigap and a D, you can go to any doctor who will take Medicare and take you. See, that's the good news. What was I just talking about?
Oh, ordering tests.
Oh, ordering tests.
Like you'll call the doctor and say, I'm not going to cover this.
Right, so Medicare's Part C, you have to get, the doctors often have to get permission to do a test that you wouldn't have to if you were on a AB supplement. And this is a question I asked at that conference. This was like the head honcho from Region 1 Medicare. And I asked, from your experience, do Medicare Part C plans tend to not give approval for plans that you would just get routinely if you had original Medicare? And she said no. She you know, you may think differently, but this person said no, she didn't think that happened very often. But you know, there's horror stories. If you go online, you can find a ton of horror stories about any plan. So, yeah.
The other disadvantage that could occur is if you do a lot of traveling and you happen to then have to suddenly go to an emergency room. Now, they do cover emergency rooms, our plan does, so anywhere. But if you have to start seeing a doctor and they don't have a network, then you're paying more for that. So that's always been a little a concern.
Well, that's true of any Medicare. Medicare doesn't cover anything in a foreign country.
Oh, I'm not talking about foreign country, I'm talking about here.
Oh, you're talking about the U.S. Oh.
Yeah.
Okay.
Out of network.
Oh, out of network.
Yeah, just out of network.
Yes.
So within the Advantage plan, then there are PPOs and did you say HMOs?
And HMOs.
So are the PPOs more open, more advantage than the HMO? And so do they cost more?
Yeah, I don't know if
PPO
they.
cost more than HMO within the Advantage?
The first level sort of HMO, then there's the PPO, and then there's the PFS, which is fee for service, something fee for service. And the HMO is the most strict. You have to see. Generally, you're going to have to get a referral from your doctor. The PPO is more lenient in terms of who you see, and I think the fee for service one is even more so.
But is there different costs for each one then? Like is the HMO less expensive than the PPO?
You know, this I don't know. It seems like it should be, but you know, yeah, probably. But you have to, like I said, if you live here, there's only 3 of these plans. It's not like a huge not a choice. Well, thank you all. This has been really fun. Thank you.